Welcome to Medicine Talk BD channel. Today we will discuss about the gastric tablet Esomeprazole. First of all, we will know what is Esomeprazole. Esomeprazole is a portion pump inhibitor. PPIs work by reducing the amount of acid produced in the stomach. Esomeprazole is used to treat gastroesophageal reflux disease, ulcer, and other conditions that involve too much stomach acid. Now we will know about esomeprazole's indication. Esomeprazole is indicated to relieve from chronic heartburn symptoms and other symptoms associated with GERD, for the healing of erosive esophagitis, for maintenance of healing of erosive esophagitis, in combination with amoxicillin and clarithromycin for eradication of Helicobacter pylori infection in patient with duodenal ulcer disease, Zollinger-Ellison syndrome, acid-related dyspepsia, duodenal and gastric ulcer. Now we will know about its dose and administration. Esomeprazole should be taken 1 or 2 capsules daily and should be swallowed whole and taken 1 hour before a meal. Now we will know about its contradiction. Esomeprazole is contradicted in patients with known hypersensitivity to any of the formulation. Now we will discuss its side effect. The most frequently occurring adverse event reported with esomeprazole include headache, diarrhea, nausea, flatulence, abdominal pain, constipation, and dry mouth. There are no difference in types of related adverse events seen during maintenance treatment up to 12 months.